करू का मग? हे खाली नाव येतं ना, हे दिसायला नको. केलं. माझं एकटीचं दिसलं तरी चालेल ना?
करा मॅडम, लेक्चर सुरू करा मॅडम.
ओके. करू स्टार्ट. Hello, sir.
Yes, ma'am.
Okay. While practicing homeopathy, the case taking is the most essential part. Then the first prescription means selection of a simillimum is the most important part, and the most difficult part is a follow-up, that is the second prescription. Okay, I am Dr. TEJASHRI VIVEK from Department of Organon of Medicine from Motiwala Homeopathic Medical College. So our today's topic is second prescription. So first, what are the objectives for learning? Okay. First is what to prescribe after assessing the prognosis of a patient. Prognosis means to know before. Next objective is to learn the different types of second prescription and their implementation. And also at the last of lecture, at the last of lecture, the students gets clear concept of the second prescription definition, what is the first prescription, and what is the relationship between second prescription and a Kent's-12 observation, that is a remedy reaction. So these are the objectives of learning. Next is a definition of second prescription. So according to Dr. Kane, the second prescription is the prescription after the first one that has acted. Okay, some changes in a patient, either good or bad. Okay, good changes means what? Good changes means the homeopathic aggravation, amelioration of symptom. Bad changes in a patient while follow-up means the medicinal aggravation, disease aggravation, symptoms take a wrong direction. These are the bad changes which are given by patient in a follow-up. Okay. Next is to know the second prescription means what? First, we have to clear our concept about the first prescription. Okay, what is a first prescription? When medicine is selected for the first time according to symptom similarity and produces some perceptible changes in the patient, it deserves the term first prescription. So understand that there should be some perceptible changes after prescribing the homeopathic remedy. Then only this prescription is called as a first prescription, means there should be the action of that remedy should be started after prescribing. So what is a no prescription? Okay, if our first prescription is absolutely patient's economy, accepting if our first prescription is absolutely wrong, there will be no change in patient's economy. Okay, except in a idiosyncratic patient, means the subsequent prescription, the follow-ups cannot be termed as a second prescription. Means first time there should be some perceptible changes after prescribing remedy, then only the subsequent prescriptions are called as a second prescription. Okay, the second prescription presupposes that first thing is what? The first one that has been correct one. Okay, next second prescription means what? The first prescription has acted, means there should be some good changes or bad changes after prescribing the first remedy. Third, it has been left alone to act a full time. Okay, these are the second prescription that presupposes. Okay, next, during second prescription, we must inquire about what to inquire in a follow-ups. Okay, first, how does the patient feel in a general? Okay, means the mental generals, physical generals, overall GC, general condition of patient after giving the first simillimum or a first homeopathic remedy. Next is, has the degree of energy been affected? Next, we have to inquire about, has there been any change in a physical chief complaints? Okay, because homeopathy is symptomatology. Okay, without symptoms in a sea of homeopathy, the case is like a ship without a compass or a radar. That's why the symptomatology is very important. So while taking the follow up, we have to inquire about the symptoms, all the symptoms which are given by the patient in the first testing. Okay, what are the changes in that symptoms? Okay, what about mental and emotional plane? Is there any appearance of a new symptom or a old symptoms in the patient? Okay, what about mental and emotional plane? Is there any appearance of a new symptom or a old symptoms in the patient? Okay, what about emotional plane? Is there any appearance of a new symptom or a old symptoms in the patient? Okay, what about physical symptoms? Is there any appearance of a new symptom or a old symptoms in the patient? Okay, what about mental and emotional plane? Is there any appearance of a new symptom or a old symptoms in the patient? Okay, what about physical symptoms? Is there any appearance of a new symptom or a old symptoms in the patient? Okay, what about emotional plane? Is there any appearance of a new symptom or a old symptoms in the patient? Okay, what about physical symptoms? Is there any appearance of a new symptom or a old symptoms in the patient? Okay, what about emotional plane? Is there any appearance of a new symptom or a old symptoms in the patient? Okay, what about
हॅलो मॅडम.
हा सर,
हा,
पीपीटी दिसतंय का सर?
नाही शेअर करा परत मॅडम.
परत शेअर करा.
व्हिडिओ पण ऍडजस्ट करून घ्या व्यवस्थित.
अच्छा.
नाही नाही चुकला तो. व्हिडिओ व्यवस्थित करा.
हो हो करते. Okay, sir, करू start.
Yes.
Next, Kent comes out the original problems such as, first, how long shall I wait and watch? Okay, is a question frequently asked but seldomly answered. Second is the remedy still acting? Is the vital reaction still affected by the impulse of the remedy? Okay. Next question. If the symptoms are returning, how long shall they be watched before it is necessary to act or give a medicine? Okay. Fourth question, is the disease acute or a chronic? Because on the because our prescription is depend upon the types of disease. Okay. Next, why is the second prescription so much more difficult than the first prescription? Okay. Why is it that so many patients are benefited when first going to the physician and thereafter derive no benefit? Means the patient is telling, डॉक्टर साहब मुझे पहले बहुत अच्छा लग रहा था जब आपने फर्स्ट मेडिसिन दिया था, लेकिन उसके बाद अभी फर्स्ट मेडिसिन से जितना अच्छा लगा था उतना अच्छा मुझे बाद में नहीं लग रहा है. ये पेशेंट का लैंग्वेज, दिस इज द पेशेंट्स लैंग्वेज अबाउट दिस. ओके. Next is, what are the prescribing milestones in homeopathy? Okay. So first milestone is, we have the clear concept of our homeopathic principle. Okay. Knowledge of our fundamental principle, knowledge of disease, knowledge of medicine, knowledge of potency. The theoretical knowledge of homeopathy should be very clear. Next, second, sound knowledge of materia medica, okay, is important for the prescription. Next, sound clinical base, the knowledge of medicine. Next, we have to take now the practical part of homeopathy, that is a detailed case history. Next, after taking the detailed case history, we have to analyze and evaluate the case, then start the repertorization. Programming the treatment, how to manage this case is important. Next is posology. Okay, study of doses, means we have the potency selection, the dose, the repetition, okay, is an important part of posology. Next is general management of that patient. Okay, his diet and regimen, how to manage that case is very important. Next is, and the difficult part is, that is a second prescription or a follow-up and assessment. Okay. Next is different types of second prescription. Okay. The first type is repetition of the first prescription. Second type is antidote the first prescription. Third type is change of remedy but having no relation to the first prescription. Fourth is complementary remedy. Okay, we change the remedy and we have given the complementary remedy. This is the fourth type. Fifth type is cognate. Okay, and next, sixth type is change the plan of treatment. Okay, these are the 6 different types of second prescription. Now, how to remember? Okay, this is the one trick for remembering the second prescription. These are the mnemonics. RAC 4. Okay, RAC, R for repetition, A for antidote, now C for change of remedy, C for complementary, next cognate, and fourth is change of plan of treatment. So understand everyone, these are the types of second prescription. Okay, now next. So let's study the first type of second prescription. Repetition of the first prescription. Okay, when we are repeating our the first remedy, okay, under the two condition. First condition is when the original symptoms return with the same physical generals, same particulars, and same mental generals. Okay. Second type, when the case become a standstill position, that means the patient comes to a status quo position. These are the two conditions under which we are repeating our first prescription. Next, the original symptoms return means where from the case began, it ends there. Okay. Means say a patient was taking medicine for rheumatic pain and came at the same point of intensity when he had started to take a medicine. Okay. The patient may say, the time I take a medicine, I feel better. There was amelioration for initial few days, but all the complaints aggravated again. The first drug acted nicely, but the second was not. That is, we are give him a cosmos or a placebo. So the symptoms again come with the same intensity. The general symptom as well as a particular symptom, okay, again come with the same intensity. That's why we have to repeat that medicine again. Okay, repetition of the same remedy. Next, the case assumes a standstill position, means we are to wait for fairly a long time for a moment of symptom. But if there is no movement of symptom any further after prolonged waiting, then we have to repeat the medicine. This is state when after the maximum wait and watch and repeated trial, the amelioration is not progressed after a certain level. Means what? Symptoms अटक जाना एक जगह पे. This is called as a standstill or a status quo. Okay. Now, for both the occasion, the same remedy is to be repeated. Okay, in this both the condition, we have to repeat the same remedy. Means the original symptoms return with the same generals and particular in a same intensity. And second condition is a patient comes to a standstill position. In this both condition, we have to repeat the same remedy. Now, next issue. Next issue is what? Come, what will be the potency? Okay. Hahnemann said to use the same potency once more. Okay, in earlier period of in earlier period, in Hahnemann's writings, you had seen that Hahnemann said to use the same potency, but later in a sixth edition, Dr. Hahnemann was very favorable to the increasing the potency. Okay, high potencies. Kant says to increase the potency. We have already seen in a Kant philosophy about the octaves of potencies. Okay, means we have to increase the potency. Increase the potency because the previous potency's action gets exhausted. That's why we have to repeat the next potency next time. Okay. Next, antidote to the first prescription. Okay, this is our next type of second prescription, that is a antidote. What is antidote? Antidote means antidote is a medicine or a substance which nullify the medicinal action of a previous drug. Antidote means a substance that counteracts the effects of poison or a medicine, etc. Okay. Indication, when to antidote the medicine. Indication, where there are three indication for the antidote the prescription. First indication, appearance of new symptoms. Okay, but not the old symptoms, not the symptoms of disease, but belonging to the medicine given. Then these new symptoms that belongs to medicine given, then you have to antidote the antidote that medicine. This is we have already seen in a Kant's 10th observation. Okay, new symptoms appear after the remedy. Okay. The appearance of new symptom after administration of medicine shows that it is a wrong. Next, when to antidote the medicine. Next is in a prolonged aggravation. Okay, prolonged aggravation and a final decline of the patient. Here also we have to antidote the remedy. Next, third is symptoms take a wrong direction. Okay, prolonged aggravation is a Kent's first observation. Okay, prolonged aggravation and a final decline of the patient. Okay, here the patient is incurable, the pathology is deep, and potency which we have selected is a wrong potency. That's why here we have to antidote the medicine. Okay, next, symptoms take the wrong direction. Okay, this is Kent's which observation? Last observation, that is a 12th observation. Symptoms take a wrong direction means what is the correct direction? Correct direction is according to Herring's law of cure. If the patient is not showing his prognosis according to Herring's law of cure, then we have to antidote that medicine. Okay, if the symptoms are taking wrong direction. In these three conditions, we have to antidote the first prescription. Okay, understand everyone? Okay. Take an example. Okay, arsenic album. Okay, arsenic album. If the patient after taking the arsenic album is showing the medicinal aggravation, then you have to antidote that arsenic album. So what is antidote of arsenic album is sepia. Okay, तुम्हें क्या करना है? You have to give the sepia medicine to antidote the action of grievous action of arsenic album. Okay, this is the example of antidote. Next is change of remedy. Okay, change of remedy but having no relation with the previous medicine or a previous first prescription. Okay, change of the remedy, the prescription of medicine which do not have any relation with the previous medicine. Okay, what are the indication for the change of remedy? There are two indication for the change of remedy. First indication, when a striking new group of symptoms appears, leading to an entire change in the pace of symptoms. Okay. And next indication, when symptoms have changed, but the patient has not improved. Okay. Means here there are two indications for the changing remedy when a striking new group of symptoms appear. Okay, when the new group of symptoms appear, a new group of symptoms appear, then what will happen? The symptoms may be of a light nature or a grievous nature. If the symptoms are grievous nature, then we have to antidote that medicine. And if these new symptoms are of a light nature, not very dangerous to the life, then you have to change the remedy. Retake the case, re-examine the patient, and give a new selected remedy to the patient. Understand everyone? Next, when the symptoms have changed, but the patient is improving, then don't change the remedy if the patient is improving. But if the patient has not improved, then you have to change the remedy. Okay, here also, if the symptoms have changed, then retake the case again. Okay, and repetize again. And if patient has not improved, then you have to change the remedy, give the minimum. Okay, after re-examining the patient. Next, now the fourth prescription. We have already seen three types of second prescription. Okay, what? First is repetition of the same remedy. Second is antidote. And third is change of remedy having no relation with the first prescription. Now, fourth types onward, here is also change of remedy, but having relation with the first prescription. Okay, means now the fourth type is complementary to the first prescription. Okay, so here what is relation between first and second prescription? The complementary remedy. Okay, complementary, the complementary word comes from the complementation. Okay, the complement means that one drug which completes the cure that has been begun by the former, but the former drug was unable to terminate in cure with the latter drug performs. Okay, second prescription that is made to complement the action of the former. Okay, in a simple language, complementary drug means the complementary drug which complete the action of previous drug. Okay, indication usually done when the first remedy is an acute one and it is to be complemented with the constitutional medicine for completion of a cure. Okay, let's take an example of complementary remedies. Constantine Herring pointed out that the second remedy must bear a complementary relation to the first. For example, when lycopodium is apparently accurately chosen but fails to act in spite of repetition. Okay, and a change of potency means after selection of lycopodium as a simillimum, we have to repeat the remedy, we have changed the potency, but the patient is not improving, is not going to state of cure. Then what we have to do, we have to give him a chilidonium, which will often start the curative process. Why this happen? Because uh, wh- uh, when you are going to study this lycopodium from the Herring's guiding symptom, you will see under the title relationship of remedy that the chilidonium is a complementary remedy to the lycopodium. Okay, J.T. Kent. Okay, in a Kent philosophy, the example of pulsatilla is given, pulsatilla and cilicia. When a pulsatilla has been of a great service in a given case and finally cures no more, while the symptoms now point to the cilicia, the latter will be given with confidence as its complementary relation has a long been established. Okay, these are the examples of complementary remedy. Okay, even a belladonna and calcarea are also complementary remedy. Okay, Dr. Farrington has described the complementary relationship between belladonna and calcarea. Okay, means take a example of a case. Okay, belladonna patient. Okay, throbbing carotids with a headache, every cold settles in the nose and all. This for these acute complaints we have prescribed that patient a belladonna as a acute remedy, but uh, belladonna is not showing the complete cure. Means again the this acute state comes again and again. Okay, recurrence of this acute state. So here the when the patient is in a normal state, then what is his tendency, what is his disposition? Okay, he's taking he's taking every cold. Okay, then his glands are enlarged. Okay, fat flabby child. So here what is indicated here, indicated constitutional remedy as a calcarea. Okay, so patient is calcarea patient, and when he is showing acute complaint of headache and coryza, then the indicated remedy is a belladonna. Now to complete the action of that belladonna and patient for the complete cure of that patient, you have to prescribe the calcarea as a complementary remedy here. Okay, this is the example of belladonna and calcarea. Now next type of second prescription, okay, is a cognate of a first prescription. Okay, so what is a complementary remedy and what is a cognate? Okay, understand the relationship between complementary and cognate. Okay, complementary remedy means the remedy which complete the action of previous drug. And here what is cognate? Cognate means the two remedies which are closely related to the each other. Means these are the action of two remedies, and here are some symptoms which are very similar to each other. Okay, they are same symptoms. Means these two remedies are closely related to each other. That's why this remedy are called as a cognate. And here the complementary means which complete the action of previous drug, means a complementary remedy. So let's study what is a cognate to the first prescription. The medicine which are closely related to each other are known as a cognates, but administering cognate is not a compulsory task in a homeopathy. Okay, means if during the course of treatment of chronic disease any acute disease or a symptom supervenes, the second prescription should preferably be a cognate of a first medicine. Okay, next is example of a cognates. Okay, suppose the sulfur we have given as our first prescription. Okay, sulfur is our first prescription, and next subsequent cognate of a sulfur is what we have prescribed during follow up is calcarea carb. Okay, next to calcarea carb, the lycopodium. Okay, lycopodium is the next cognate to calcarea. Okay, means first prescription is sulfur, next cognate uh, while prescribing during follow up is calcarea carb, and calcarea carbs cognate we have prescribed lastly is a lycopodium. These three are cognates to the each other: sulfur, calcarea carb, and lycopodium. Next example is for the bilious fever in a sepia constitution. Okay, is likely to call for a nux vomica. That's why for the acute complaint, so sepia and nux vomica are the cognates. Understand everyone? Okay, next, so don't intermingle with a complementary and a cognate remedies. Okay, so this is the difference between complementary remedy and a cognate remedy. Cognate remedy are closely related to each other, means some symptoms are very closely related to each other of these two remedies, and here complementary remedy which completes the action of previous drug. Next, sixth type is change of a plan of treatment. Okay, this is the last type of our second prescription. When the symptom of another miasm has come up in a prominence with a disappearance of symptom of a previous miasm treated. Okay, for example, okay, mostly this change of plan of treatment is occurring where there is a mixed miasmatic cases. Okay, means more than one miasm is present, then only we are using this second prescription. Take an example. If a psoric case after treatment with a proper antisoric medicine may come out with another miasm in a prominence, on analysis of group of symptom will show that it may be belongs to these symptoms while follow up to syphilitic miasm or a psychotic miasm, then the plan of treatment will change according to prominent symptoms. Okay, now these are the six types of second prescription. First is repetition of remedies, second is antidote, third is
Hello.
हो. Okay, the outcome of homeopathic treatment is now assessed on the basis of, so what is important for the second prescription. Okay, first, the knowledge of Kent's 12 observation, knowledge of Herring's law of cure, knowledge of potency, knowledge of symptomatology. These are the important points for the assessment of the follow-up. Okay, the symptoms, this is a language of the nature. That's why signs and symptom are the only guidepost available for the homeopaths. That's why knowledge of symptomatology is very important in a second prescription. Okay, and the second prescription and the remedy reaction, Kent's 12 observation are the inseparable topics. That's why their knowledge is very important. So now let's see the view of the modern stalwarts of homeopathy. According to Luke De Shepherd, things to be answered before giving a second prescription. Is there any obstruction of medicine to acts such as patient lifestyle, diets, habits, etc.? Okay, means if there is a stress, this may act as an obstacle to cure. Okay, next, any new events occur in a patient's life between first and second consultation. Okay, this may be a death of his relative or a friend. Yeah, maybe he has taken some poisonous thing or antidoting the medicine unknowingly. Next, find out if the potency given is appropriate. Okay, now, next view of Dr. George Vitholkas. The first prescription is the most important decision made in homeopathy, and the follow-up prescription is very likely the most difficult prescription. The second prescription demands more knowledge, more sensitivity, and a more judgment. Next is the Margaret Tyler, okay, follow-up of Dr. Kent. She says, you have fouled the clear waters with a wrong and hasty prescription. That's why Kent, in his Kent philosophy, told us that about the wet and wash tendency. Okay, the homeopathic physician should be a patient, should have a patience. That's why the wet and wash tendency should be there. Okay, now let's revise our today's topic. What are the types of second prescription? Okay, repetition of the same remedy. Next is antidote to the first prescription. Next is change of remedy but having no relation with the first prescription. Okay, next, change of remedy with relate to a first prescription, means complementary to the first prescription, means the which complete the action of previous drug. Next is cognate remedies. Cognate remedy means the two remedies which are closely related to each other are called as cognate. For example, sulfur, calcarea, and lyco. Next, change of plan of treatment. This is mostly in a mixed miasmatic cases. The change of plan of treatments means give the anti-miasmatic drug of dominant miasm, then that dominant miasm become cured, then give the next anti-miasmatic drug. Okay, so we have completed our chapter of second prescription. Okay, even the second prescription may have two types again, which I have not mentioned in your textbook. That is a placebo. Okay, and second is intercurrent remedies. Okay, these are the two types which are also a second prescriptions. Now, the university final exam questions which are mostly asked, first is define and describe types of second prescription in detail. Second, relate the second prescription with a Kent's 12 observation in detail, or explain that second prescription and a remedy reaction are inseparable. Okay, this LEQ may come. And third is SAQs, antidote, complementary remedy, cognate remedy. Write down the difference between complementary remedy and the cognate remedy. These are the MUHS questions for your theory exam. Okay. So thank you everyone. Thank you. Thank you the MUHS for giving me this opportunity. Okay. Hello sir.
Yes ma'am,
Some plus hello.